about diabetes. And just to throw it out there, diabetes affects Chicanos and Latinos the most. We are the ethnic group that is at highest risk as of now. And me personally, I am a high risk factor individual. Both my grandmothers on both sides have diabetes. My mother had gestational diabetes, which means that while she was pregnant, she had diabetes. And then she was left with diabetes after she had my sister. So technically, every time I go to the doctors, they're kind of like freaking out because they kind of want to know how I'm doing. So I'm going to start out by explaining to you exactly what diabetes is, the effects it has, the ways it affects Chicanos, and the risk factors and how to prevent it. So diabetes is a condition that is pretty much defined by high glucose levels in your blood. And that means also that insulin does not work, or your body does not produce insulin. There are three main types of diabetes. Diabetes 1 is the less common form of diabetes, and it's usually present in young, either teens or children. It's the most people you see it in. And in this case, the body does not produce insulin, so it's usually a birth defect as well, like kids are just born with it, or they develop it later on. Type 2, this type is most common and is also known as hyperglycemia, and it causes the glucose levels to go very high. And in this case, your body does not use your insulin, so even though you do produce it, your body kind of doesn't know what to do with it. And the third type is gestational, and that means that it occurs in women around the 24th week of pregnancy, and they already have diabetes, so they have to go through a diet and to keep themselves at levels because it can also affect their child. And one of the things that can happen when you have diabetes while you're pregnant is your child can be born with amputations and deformity because of your blood, the way your blood works, because your blood helps develop the child, so it can affect it as well. And just to say what exactly insulin is, it's a hormone produced by your pancreas, and it is needed to convert sugars and starches and other things that you eat into energy for your body. So if you don't produce it or you don't use it right, it's kind of just being stored in your body, which makes your sugar levels rise. So what can it affect? It can affect your eyes. It can also make you more prone to a heart attack or stroke. It can lead to an amputation, kidney disease, and many other diseases. So diabetes in Chicanos and Latinos. Diabetes in Chicanos and Latinos is almost double that of non-Latinos. One of the main reasons why Latinos kind of don't attend themselves is because they feel guilty. Most moms are like as she mentioned, it's like your mom role is your mom role and then it's you. And I mean, you kind of have to attend yourself so you can attend your children, and the same goes for the male figure as well. Another reason is the traditional way of eating that Hispanics have. The tortillas are always on the table, and many other things. And the coffee and bread, after like dinner and this and that. So that's another reason. Hispanic adults are 1.7 times more likely to be diagnosed with diabetes. In the age range of 18 to 44 years old, Latinos are 3.2% are more diagnosed with diabetes compared to 1.3% of non-Hispanic whites. And diabetes rates more than double on Latinos that are obese. Oh. So risk factors. So pretty much you can kind of know if you're at risk by answering these simple questions. Are you overweight? Do you exercise regularly? Are you 45 years of age or older? Do you have a family history of diabetes? If you're a woman that has had a baby weighing more than 9 pounds, and if you have had gestational diabetes. Another thing I'm going to rule out is just because you had gestational diabetes does not mean you will have diabetes after you have the child. You can go back to normal after it. So another key factor to get away from this is prevention. So Chicanos and Latinos, and just everyone in general, should know that they need to care for themselves in order to care for their families as well, and it does not mean you're being selfish, that you're caring for yourself. There's also alternative ways of cooking. Also, I believe it's the ADA offers a hotline, it's 1-800-DIABETES, and they offer recipe books that'll to help help Hispanics in particular still cook healthy and keep their iconic flavors. Another thing is keeping up with their ideal weight, even if that means losing some pounds. And then I guess the most of all is being active. And also visiting your physician regularly. You won't know if you're at risk just by answering those questions. You also need to go visit a doctor regularly to know if you are at risk or not. So in conclusion, diabetes is a severe problem within the Chicano Latino community. There's 3 types, and in most of the types, it either means that you do produce insulin or that you don't use it properly. It's a serious problem in Chicano Latinos because their lifestyles, their way of thinking, and they do have the largest affected individuals. There are many things that can be done, and I think the biggest thing that there's many risks, there's many things that it can affect, but the biggest thing that there is there's prevention. So even though there's many risks that can happen, risk factors, there's many effects, the biggest thing and the biggest list of things you can do is prevention. There's many ways to prevent it. So I encourage you all to jump into your own prevention, because just because you're not Latino or you're not Chicano or you're whatever, you're still at risk. So the best way to keep away from it is preventing it. Like me, myself, I've tried to stay away from things because I'm highly prone from either sides of my family, my mom. So I'm directly a high-risk individual. So thank you for your time.